If someone told you there is one trick, one supplement, or one miracle routine that can prevent multiple sclerosis, I need you to slow down for a second. Because that is exactly how good people get pulled into bad medical advice. Right now, there is no known way to fully prevent MS. None. And if a video skips that sentence, it is not protecting you. But here's the good news. Even though medicine cannot promise a guaranteed prevention plan, we do know some things that appear to raise risk, and we do know some mistakes that are just plain dangerous. That means you can make smarter choices for yourself, and maybe even more importantly, for your children, your adult children, and your grandkids. And yes, I know what some of you are thinking. Doctor, I am over age 50. MS usually shows up earlier, so why should I care now? Because prevention is not only about you getting a diagnosis tomorrow, it is also about not ignoring early warning signs, not falling for supplement myths, not smoking, not brushing off secondhand smoke, and not missing the family patterns that matter. By the end of this video, you are going to know what science actually supports, what it does not support, which myths can waste your time or hurt you, and which symptoms should make you pick up the phone quickly. We are also going to talk about one virus that has a very strong link to MS, one vitamin people constantly overhype, and one lifestyle factor that deserves way more attention than it gets. So let's do this the right way, calmly, clearly, and without pretending medicine knows more than it really does. First, let's make sure we are talking about the same disease. Multiple sclerosis is a condition where the immune system attacks myelin in the brain, spinal cord, and optic nerves. Myelin is like the insulation around electrical wires. When that insulation gets damaged, the signals do not travel the way they should. That is why MS can cause vision changes, numbness, weakness, balance trouble, bladder issues, fatigue, and a long list of other neurologic symptoms. One reason this topic gets confusing is that MS does not have one simple cause. It is not like touching poison ivy and getting a rash. It seems to be a mix of genetic vulnerability and environmental exposures. In other words, some people are more biologically susceptible, and then certain outside factors may push risk up. MS can happen at different ages, but it most often begins between ages 240. That matters. It means some of the strongest prevention messages may be most important for younger people. But that does not make this video irrelevant if you are older. It makes you the messenger. You may be the person in the family who finally stops the smoking excuse, questions the supplement nonsense, or recognizes a warning sign early. And here's another reason older adults should pay attention. New neurologic symptoms in later life should never be brushed off. Sometimes people assume numbness, vision changes, or balance trouble are just aging. Sometimes they are not. Sometimes they are MS. Sometimes they are something even more urgent like stroke. So prevention and awareness go together. Now let's talk about the clearest prevention target we have. If you want the shortest list of MS prevention techniques that actually make medical sense, smoking belongs near the top. This is one of the clearest modifiable risk factors in the whole conversation. Official sources and major MS centers consistently say people who smoke are more likely to develop MS. Smoking is also linked to more aggressive disease once MS is present. And this is not just about cigarettes. Secondhand smoke matters too. That is a big deal, especially for families. A smoke-filled home or car is not just a heart and lung issue. It may also be part of an MS risk story. This is where people get tripped up. They think, well, I only smoke outside, or I only smoke when I am stressed, or it is just social. Your nervous system does not grade on a curve. Smoke exposure is still exposure. And for grandparents, parents, and caregivers, that exposure may affect younger people during the years when prevention matters most. Now, does quitting smoking erase all prior risk? We cannot promise that. But quitting is still one of the smartest health moves you can make. It helps your heart, lungs, blood vessels, bones, cancer risk, and very likely your neurologic future too. And if someone already has MS, stopping smoking may help reduce progression compared with continuing. So the practical advice here is simple. If you smoke, ask for real help. Counseling, quit lines, nicotine replacement, and prescription support can all be part of a serious quit plan. If you do not smoke, protect your space. Make your home and car smoke-free. And if a loved one is younger, please do not tell yourself they will sort it out later. Prevention usually gets more expensive when later arrives. Now for the part that surprises a lot of people. The virus with the strongest link to MS is Epstein-Barr virus, or EBV. That is the virus best known for causing mono. A major study summarized by the NIH found that people infected with EBV were times as likely to develop MS as people who were not infected. That sounds huge, and it is huge. But this is where a responsible doctor has to add the second sentence. Most people who get EBV will never develop MS. In fact, EBV is extremely common. So this is not a reason to panic if you had mono in high school, college, or years ago and barely remember it. What this finding really tells us is that EBV seems to be an important trigger in the chain of events that leads to many MS cases. It does not mean EBV is the whole story. It also does not mean the internet immune cleanse crowd has discovered a magic answer. They have not. As of now, there is no vaccine to prevent EBV. So what can you do? Mostly reasonable infection hygiene. Do not share drinks, utensils, or toothbrushes. Be careful about kissing when someone is clearly sick. Teach teens and younger family members that just a little mono is not a joke. These steps are common sense, not perfection. And here is the emotional trap I do not want you falling into. Some viewers hear the EBV link and think, well, if I already had it, I am doomed. No, that is not what the science says. The correct message is this: EBV matters, but it is not destiny. So do not turn a real risk factor into a hopeless story. Let's talk about the vitamin that gets treated like a superhero online. Vitamin D. This topic needs nuance. Low vitamin D levels are linked with a higher risk of MS. That link shows up again and again. There is also genetic evidence suggesting vitamin D biology may play a real role in susceptibility. But here's the part many videos skip. A link is not the same thing as proof that taking extra vitamin D will prevent MS. Right now, scientists have not proven that vitamin D supplements prevent MS, and major reviews have not shown clear clinical benefit from vitamin D supplements in people who already have MS either. So what should you do with that? Be reasonable, not reckless. If your clinician tells you that you are low in vitamin D, especially as an older adult concerned about bone health, follow medical advice. That is very different from swallowing huge doses because a stranger online promised nervous system protection. More is not always better. High-dose vitamin D can cause real harm. Weight is the other piece people underestimate. Higher body weight earlier in life, especially in childhood or adolescence, appears to matter for MS risk. That means many viewers age and older may be hearing a prevention message that is less about rewinding your own life and more about protecting the next generation. Help your family normalize healthy meals, movement, sleep, and less processed junk. That is not a flashy answer, but it is a medically honest one. And notice what I'm not saying. I am not telling you that yoga, detoxes, Mediterranean diet plans, or fancy supplements are proven MS prevention. They may support general health. They're just not proven shields against MS. Now let's cover the symptoms that should never be brushed off, because one of the worst prevention mistakes is not a food mistake or a supplement mistake, it is a delay mistake. If you develop new neurologic symptoms that build over hours or a day and last more than hours, that needs medical attention. Examples include vision loss in one eye, pain with eye movement, new arm or leg weakness, numbness spreading up the body, clumsy walking, or a strange electric shock feeling when you bend your neck. Those symptoms do not diagnose MS by themselves, but they absolutely deserve evaluation. But for my older viewers, there is an even more urgent rule. If symptoms are sudden, think stroke until proven otherwise. Sudden one-sided weakness, sudden facial droop, sudden trouble speaking, sudden trouble seeing, sudden loss of balance, sudden severe headache with no known cause. In the United States, that is a moment. Not a next week appointment, not a supplement, not a nap. This matters because some stroke symptoms and MS symptoms can look similar at first, and stroke treatment is time sensitive. Minutes matter, so if your body suddenly does something alarming, do not sit there trying to be tough. And one more mistake to avoid, do not let temporary improvement fool you. Even symptoms that fade can still signal something serious. Sometimes people delay because they feel a little better by morning. That is not a reliable safety test. If your nervous system throws a red flag, respect it. Medicine cannot prevent every neurologic disease, but it can help you avoid the damage that comes from waiting too long. So let's bring this home with a simple checklist you can actually remember. Number 1, do not smoke and do not normalize secondhand smoke. If you want one of the clearest risk reduction targets, start there. Number 2, do not treat vitamin D like a miracle drug. If you need it, use it wisely with your clinician. If you do not know your situation, do not assume more is safer. Number 3, do not hear EBV and assume fate. The link is important, but most people with past EBV infection never get MS. Use common sense infection habits, especially around younger family members. Number 4, Do not confuse general wellness with proven MS prevention. Good habits matter, but no detox, no supplement stack, and no influencer protocol has earned the right to promise prevention. Number 5. Do not ignore new neurologic symptoms. If symptoms are new and persistent, call a doctor promptly. If they are sudden and stroke-like, call 911. And number 6. If you are over age 50, remember, this may be a family protection story as much as a personal one. You may be the one who teaches the next generation not to smoke, not to shrug off secondhand smoke, not to chase internet cures, and not to ignore warning signs. That is what real prevention looks like. Not certainty, not hype, just fewer bad risks, fewer bad delays, and better decisions. If this video helped you cut through the noise, share it with someone in your family. It may spare them a dangerous myth at exactly the right time.